Good afternoon, everybody. My name is Nancy VanReece, and I want to welcome you to this very important webinar. We are doing this in partnership with Mayor John Cooper's office, as well as the Metro Nashville LGBTQ Caucus. We are very excited to share some information with you today and to have a general discussion about LGBTQ health in Davidson County, Tennessee, and in the United States of America. Quick housekeeping, we are going to take some questions in the latter part of this webinar. We are taking those questions via email and will be selected from those emails as we have time. Any leftover questions will be responded to by one of our appropriate panelists. The email address to use for your questions is my name, Nancy, N-A-N-C-Y .VanReece, V-A-N-R-E-E-C-E @nashville.gov. That's nancy.vanreece @nashville.gov. You can send those questions in at any time during this webinar. We will address them in the latter portion. Just to give you an overview of what we're going to be doing here today, the first folks that we're going to hear from are from Vanderbilt, and specifically the Center for Medicine, Health, and Society at Vanderbilt University. First, Tara McKay. Dr. McKay is going to talk to us about LGBTQ Americans overall, based on some new research that's been done. And then Gilbert Gonzalez, Dr. Gonzalez is going to talk to us about Nashvillians and how a new study that he's been undertaking is directly affecting our conversation. And then back to Tara in regard to conversations specifically about LGBTQ Americans that are older. And as someone over the age of 55, the definition of older we can talk about as well. After that, we're going to hear from three nonprofits that we're very proud of here in Nashville, including Nashville Cares, 50 Forward, and Launchpad. So I don't want to spend too much more time. We want to make sure and spend as much time as we can with you on your Q&As as well. So first, I'm going to throw it over to Tara McKay. Thank you so much, Dr. McKay, and we look forward to hearing from you.
Thank you, Councilmember VanReece, and thank you to the Mayor's office for providing a space for us to present this research. As Councilmember VanReece mentioned, I'm going to start off talking about how COVID is impacting LGBT Americans. This is a national study. We'll then present some information from Nashville and from Tennesseans, focused on older Tennesseans specifically. To start out, I want to give us all a little bit of a framework for thinking about why we're here today. LGBT Americans are at increased risk of infection. We have higher rates of underlying health conditions throughout our community. That includes things like HIV, but also higher burdens of heart disease, diabetes, and asthma, as well as higher rates of smoking in certain parts of our communities and other pre-existing conditions and mental health concerns that we want to be attentive to as we're thinking about who might be at risk in our communities. We also have expectations that there are increased risks of economic impacts. There's been a few studies recently about how LGBTQ Americans are more likely to be working in highly affected industries. This might be healthcare, this might be service industries, this might also be creative industries. So we're seeing higher economic impacts for people who have been laid off or furloughed or who are now essential workers. That might affect their risk for the disease as well as for economic impacts. And then we also are concerned about LGBTQ families. Compared with different sex couples, LGBTQ couples raising children tend to have lower incomes and higher levels of poverty nationally. So this is an area where we're concerned about people and families kind of continuing to experience those losses economically. Finally, we are thinking about increased risk of social impacts of the disease. Some members of our communities are already very socially isolated. This is especially true for older gay men who are the most likely among our communities to say that they live alone and have no one to call in the event that they get sick or need help with something. LGBT folks are also at high risk of becoming disconnected from critical social supports. This might be their families of choice, their other social supports within the LGBT community, or it might be other things like substance use and recovery programs, which are a critical resource for people in our communities. So our partner, the Henny Group, and I, along with Dr. Gonzalez, set out to study how COVID was actually affecting LGBTQ Americans. And so we launched a survey early in April, beginning April 10th, to nationally get a snapshot through a quick anonymous online survey instrument that was going to capture how people were individually responding, what kinds of behavior changes they were implementing. Were they washing their hands more? Were they wearing masks? Are they doing other things to kind of limit their risk in the household as well as outside of the household? What other concerns do they have? We really wanted this to be a rapid assessment, a time-bounded assessment, so that we'd be able to look on this period of rapid change and see what's going on, how people are responding, what kinds of risks and concerns are emerging. So in this 1 month period, we got about almost 2,000 completed surveys as of May 10th. The survey is still collecting data, and we'll continue to update it and relaunch it throughout the summer to see how things are changing for folks. But right now we have respondents from all 50 states and the District of Columbia. Some of the important elements that we're seeing are that we are mapping well onto national estimates of LGBT folks and demographics nationally. We have strong representation across all regions, as well as in the South. We have good representation across gender, and we're skewing a little bit young at this point. So some of our respondents may be more affected by things that affect younger adults at this point that we're seeing. But otherwise, we're tracking fairly well with national estimates of the LGBT population. One thing I do want to highlight for you that might be relevant to risk as we go forward, and certainly for service provision, is that almost a third of folks over age 45 say that they live alone. This might be something that we're concerned about as we continue to look at things like social isolation, at people needing assistance that are unable to get it, and so on as the epidemic continues. So first, I'll start with some of our key findings around health impacts. We were interested in seeing what kinds of risk factors people had in terms of whether they'd been sick recently, sick in the last 4 weeks with a flu-like illness, whether they'd had contact with someone who was known to be positive, whether they were continuing to travel internationally or after February 1st, and whether they tested positive. This is a small group, but there are some who were able to access a test before May 1 and tested positive. So in our survey before May 1, we see almost a quarter of folks have any risk factor. These risk factors are going down for our group that's after May 1st. And the sample split about evenly in half here. So getting good representation on both sides. So folks who've been sick have contact with a known positive person or who traveled. This does seem to be declining for this group after May 1. Unfortunately, we see the economic impacts staying fairly stable. So in terms of job loss, we see very high rates of folks reporting that they lost their job before May 1 in the last month. So this isn't just any time in the year. This is in the last month, I lost my job. And so we see about 18% reporting this from April 10th to May 1st. Nationally, around this time, we're seeing about 12% of the U.S. population reporting job losses here. So that expectation that we would see higher economic impacts, especially job loss and reduced wages among LGBT Americans, is being borne out here. After May 1, we see this at about 16%, staying fairly stable. We see high rates of reduced wages. 3 in 10 LGBT Americans are reporting reduced wages, both before and after May 1st. We see high rates of food insecurity. This is even higher in May before May 1st, with almost 1 in 3 reporting that they have difficulties accessing groceries and being able to buy the food that they need. We're also interested in healthcare impacts. We understand that a lot of folks in our community have underlying conditions. They need to be able to access medical care. They need to be able to access routine medications. And the difficulties here tend to be increasing. So before May 1, we see about 1 in 4 folks were having difficulties accessing medical care. This increased to 29% after May 1. Several folks are avoiding routine medical care. Might be a concern, again, for folks who have underlying health conditions that might need regular follow-up, such as hypertension, for example. We see difficulties accessing routine medications. This is almost 1 in 5 LGBT Americans after May 1 is having difficulties accessing routine medications. And then finally, we were concerned about other issues that might be specific to the LGBT community. So we asked about whether people were concerned about how HIV might affect COVID risk, treatment, and recovery. And this concern here is high. It's not limited to HIV positive folks. In this graph on the left, you see HIV positive gay men are certainly the most concerned about how HIV might be affecting COVID risk, treatment, and recovery. But lots of other folks in our communities are concerned about this. We're linked to each other and also concerned about people in our networks who are close to. So HIV negative men, 40% are concerned about how HIV might affect risk of treatment. Lesbian women, 27%, and about 35% of transgender folks in our survey are concerned about how HIV is going to affect COVID risk, treatment, and recovery. We also had several questions and comments about what role PrEP might be doing. So this is an area that where we need a lot more information. We have people kind of responding individually and thinking about ways that HIV might affect their own risk. And it's important to capture these things, but also to provide some data and information where we just currently are lacking that. I will turn this over now to Dr. Gonzalez, who's going to talk about LGBT Nashvillians specifically.
Thank you, Professor McKay. I'd like to remind the audience that if you have a question, please submit your question to nancy.vanreece@nashville.gov. Now, Professor McKay provided us a national snapshot of LGBT health. And so we dug deep and we found some information on LGBTQ Nashvillians and their demographic and health measures. The next slide shows the source of our data. And so for this part of our research, we use data from the Nashville Community Health and Wellbeing Survey. This is a data set, a representative data set that was sponsored and marketed by Nashville Health, which is a local nonprofit, and the Metro Public Health Department. This is an important data set for our community because it's a representative sample of adults aged 18 and older living in Davidson County. And information was collected between October 2018 and April 2019. I will note that children are not represented in this data set. Now, there's some strengths and limitations to using the Nashville Community Health and Wellbeing Survey. First, there is a low response rate. About 16% of our community who received this questionnaire, either in the mail or online, only 16% responded. So this may underestimate some of the health measures that I'll be reporting here. What that means is that some of the health dimensions and health measures may actually be worse than what is reported here today. Another issue for the LGBTQ population is that that the Nashville Community Health and Wellbeing Survey did not collect information on immunosuppressed disorders like HIV, which we know is more prevalent among the LGBTQ population compared to the non-LGBTQ population, and is a special risk factor for COVID-19. But again, this is one of the most representative data sets that are available. It collected information on 1,800 county residents, and to date is one of the most richest data sources for monitoring health in the county. Now, this next slide shows the demographics of LGBTQ adults versus non-LGBTQ adults. Interestingly, approximately 6 to 8% of Nashville adults identify as LGBTQ. Those LGBTQ Nashvillians are more likely to be male, They're also more likely to be younger. About 80%, 81% of them are under the age of 50. Roughly 19% are over 50. There are similarities in race. 46% of LGBTQ Nashvillians are non-white, and 42% of non-LGBTQ Nashvillians are non-white. LGBTQ Nashvillians are much less likely to be married. About 16% of them are married, but many of them are raising children in their homes. About 39% of LGBTQ Nashvillians have a child in their home and are raising or rearing a child in their home. And that's compared to about 29% of non-LGBTQ Nashvillians. Living alone is very similar. And in terms of income, 30% of LGBTQ Nashville adults are in households with less than $25,000 of annual household income, which is just slightly higher than non-LGBTQ Nashvillians. This next slide shows where LGBTQ Nashvillians are living. Now, the map on the left shows the hotspots for the new cases of COVID-19 last week. And we can see that those new cases were concentrated in the downtown area and along the southeast corridor along I-24. The map on the right shows the distribution of where LGBTQ Nashvillians who participated in the Nashville Community Health and Wellbeing Survey live. And most of them live in some of these hotspot regions along or beneath the I-40 corridor. 36% of LGBTQ Nashvillians are living in that southeast zone. 30% are living in the Nashville Promise Zone, that blue area in the middle. And 14% are living in the southwest zone or in the east zone. But it's that zone at I-40 and south of it that is really some of the hot spots of the new COVID cases. And we suspect that more than half of LGBTQ Nashvillians may be living in these regions. This next slide shows the health measures for LGBTQ adults living in Nashville and Davidson County. And the two striking outcomes are that LGBTQ Nashvillians are much more likely to be uninsured and much more likely to be living with mental distress. And remember, these data were collected before the COVID-19 pandemic. So this certainly and probably has changed in recent months. Prior to COVID-19, 30% of LGBTQ adults living in Nashville and Davidson County were uninsured. About 10% of them reported poor or fair health. 36 or 1 out of 3 of them reported frequent mental distress. And 30% had any chronic disease or reported being told that they had a chronic disease by a provider. And those diseases are listed at the bottom, which include diabetes, asthma, emphysema, COPD, coronary heart disease, and previous heart attacks. All risk factors that we know are risk factors for severe illness under COVID-19. Now, when we add severe obesity, or when a person's BMI is greater than 40, about 35% of LGBTQ Nashville adults over the age of 18 are at high risk for severe illness if they are infected with COVID-19. And that's slightly higher than the 30% of non-LGBTQ Nashvillians. Now, the next slide looks at the most important high-risk group under the COVID-19 pandemic, and these are our older adults. And this figure shows the same health measures for older LGBTQ and non-LGBTQ Nashvillians who are 50 years or older. And we find that they are at higher risk for severe illness under COVID-19 compared to their non-LGBTQ peers. 27% of older LGBTQ adults in Nashville report poor or fair health. 41% report frequent mental distress. 50% have any chronic disease. And when we look at that high risk factor for COVID-19, we find that more than half, 56% of our older LGBTQ Nashvillians are at high risk for severe illness if they are infected with COVID-19. And that's much higher than the 41% for their non-LGBTQ peers. Now I'm going to pass it back to Professor McKay who will tell us more about the experiences of older LGBTQ adults in Tennessee through the COVID-19 pandemic.
Thank you, Dr. Gonzalez. So this final study that I'll mention brings data from a new study that's currently collecting data. So these are preliminary results. The study is called VU SNAPS. It's the Vanderbilt University Social Network Aging and Policy Study. We had always intended to be collecting data right now, but the epidemic kind of created a new need and concern among our team. And so we were able to add questions about how people were responding, as well as the effects of COVID-19 on older LGBTQ Tennesseans. We're also recruiting and surveying folks in North Carolina and Alabama. This is all underway. We don't have enough information from folks in these other states yet to be able to tell you about that, but I expect that as over the next few months, we'll be able to provide updates about those particular states, as well as an overall kind of take once we have our full sample recruited about what some of these impacts have been. So what I'm about to present to you is certainly not representative. We only have 134 Tennesseans who were enrolled by the time we put these data together, but we do expect COVID-19 impacts to be more acute for older LGBTQ adults in Tennessee. And we want to give you some context that kind of brings their voices back to all of these numbers that you're seeing. So we've highlighted some of the open-ended quotations that they've provided in relation to how the epidemic is affecting. So first off, key findings from these preliminary data are that 98% of older LGBTQ Tennesseans have been significantly affected by COVID-19. Some of the biggest areas that we're seeing people report about are loss of financial resources, loss of social connections with increased stress and isolation, as well as worry about exposure and concerns about the response and leadership. So to start off with concerns around loss of work or reduced income. So as Dr. Gonzalez has mentioned, prior to the epidemic, LGBTQ Tennesseans and Nashvillians were already more likely to have incomes less than $25,000 annually, to be food insecure, to be uninsured. Several older adults in our survey are reporting job loss, wage loss, insufficient funds to cover expenses like housing or groceries, which is only going to be compounded by the state that they're starting at. Some of the kinds of quotes to kind of give you a sense of what this experience is like for people. An older gentleman wrote in, "I have no work. I'm only receiving unemployment. I had to make arrangements with my landlord to pay rent as I received my funds. In 6 years, I've never been late with rent." So this is not only a financial stressor that might jeopardize his housing, but also an emotional identity kind of experience. We also had a woman write in about her spouse who had a significant pay cut at work while she lost part of her benefits package. So we see these kind of compounding effects, as well as things that for people in the 50 to 60 or up to 65 age group might affect their longer term course in terms of being able to retire, for example, or have benefits longer term. We also see loss of critical social supports. There are a lot of different kinds of social supports that people are mentioning here. That might be things like family, including taking care of parents, not being able to see parents. Someone reported their parent is hospitalized and they're unable to visit them. These are all very stressful experiences for folks across the board, people unable to see their adult children or grandchildren. But we also see a lot of people mentioning they're unable to see friends or other social and emotional supports from the LGBTQ community, which provides some of that critical support for people, as well as substance use support groups. Several people are reporting that they feel disconnected from these groups, which they were previously engaged with, that engaging with them online is certainly a different experience, and that they're not able to do that. We also, although this is not a majority experience, we also had people reporting that they're sheltering in place with non-affirming adults. That might be another family member, that might be a roommate who they're now spending more time with and regretting it, et cetera. But there are certainly people who are in positions where they're in a hostile environment or an uncomfortable one at a minimum, and in some cases is experiencing violence or abuse. People are also expressing a lot of stress and concerns about isolation. So 1 in 3 people in our initial preliminary data are feeling isolated every day in the last week. This is very high for this metric. 1 in 3 report feeling depressed at least some of the time in the last 30 days. Those mental health kind of concerns that we have and the needs in this community are high for this area. A quote to kind of give you a sense of some of that isolation. I haven't left my property in about a month. I haven't been in the company of a living human being for about 3 weeks, other than the Walmart delivery guy for a few minutes. So just these very exasperated and stressful feelings of isolation and depression. On the flip side of this, we're also seeing several people write in about being essential workers and the stress that causes them. They're worried about exposure to the virus. They're worried about bringing it home to their families and households. They're concerned about their regular job stress, which is higher than usual. So, for example, we have a quote here from someone who works in a grocery store. Since COVID, it's now a very stressful job. I'm grateful to have the income, but worried that I'll catch COVID and die. There are a lot of concerns like this. To kind of generalize that, we also see that 83% of our sample right now is viewing COVID as a significant threat to their health. Again, this is older adults. They're concerned about this actually impairing their health. 70% view COVID-19 as a significant threat to their life, whereas just 12% trust the federal government to combat the disease. A somewhat higher amount, 27%, trust the Tennessee state government to combat the virus. So ultimately, there are some opportunities, I think, here for thinking about how to engage this community, how to provide leadership here, and policies that are going to ultimately help them and engage them. Just to overview, we talked about 3 different studies. The first is about the impacts of COVID-19 on LGBTQ Americans nationally. Key takeaways here, most people are taking precautions, but we do have some elevated health risks, and we see evidence of economic impacts that are elevated relative to general population, as well as social impacts. Dr. Gonzalez presented new data on the Nashville Health and Wellbeing Survey, which highlights specific concerns around health risks, social risks, mental health risks, and geographic risks in our city relative to where new cases are occurring. And finally, I presented to you a little bit of information on older LGBTQ Tennesseans and COVID-19 from our VU SNAP study. This highlights the economic impacts that people are experiencing right now, as well as the social and mental health impacts, and highlights an opportunity for leadership. Again, if you have questions, we've got the email address, nancy.vanreece@nashville.gov below here. I'll end here and turn it over to our community partners.
Thank you so much, Dr. Gonzalez and Dr. McKay. We really are fascinated by the research that you've done. We will be providing the slides to all of these projects to the mayor's office so that they can put that on the COVID-19 resource page, along with the recording of this presentation. We had 3 or 4 questions already come in, and we will hold those to the end. We want to move forward to hearing about community partners and how they are responding to some of the opportunities as well as challenges that have been presented. First with us is Gretchen Funk, the Chief Program Officer for 50 Forward. Gretchen, thank you so much for being with us today, and please share what 50 Forward is doing.
Thank you so much, Councilmember VanReece. I'm honored to participate in this webinar. So much important information has already been shared, and I'm happy to share information about 50 Forward services in the community. 50 Forward's nonprofit mission is to support, champion, and enhance life for older adults in Middle Tennessee. We primarily serve Davidson and Williamson counties through 7 lifelong learning centers, a number of volunteer opportunities, and many supportive care programs, including care management, making connections to folks to needed resources, many of the things that Gilbert and Tara talked about being important needs for this community. Also through a Victory Over Crime program that supports older adults affected by crime in Davidson County, and through our home delivered meals and adult day service program. Right now, our in-person activities are primarily paused, as is understandable. And I'm going to talk about the essential services that we're continuing to provide, though. I do want to mention that at 50 Forward, we have a special interest in meeting the needs of older adults in the LGBTQ community. Over the last 18 months, we engaged as an agency in an intensive look at the needs of individuals who are LGBTQ. And we spoke with many partners, many stakeholders to determine what those needs were. At the same time, Nashville Pride was conducting their wonderful community visioning project. And we were both able to see that before COVID-19, there were already unmet needs for this community. So I am honored to serve as co-chair on the Nashville Pride's Community Visioning Project Older Adults Task Force, along with Joe Interante. So we are going to be making recommendations going forward about specific service to this group of people. Right now, as you have seen, the impact, as Gilbert and Tara discussed, on individuals over 65 across the board, and especially in this community, are very substantial. So needs that already existed around access to medical care, access to insurance, social isolation, those have just been exacerbated by this crisis now. One thing that I do want to say as an advocate for older adults is that we do have to remember our strengths. So wisdom and resilience are things that come with being an older adult in our community. And I think especially about the LGBTQ community, which the older adults in that group have faced so many challenges, but also in their lifetime seen so many successes. So I think we need to have some feeling that we have weathered many things and that we will weather this together as well. And 50 Forward wants to partner with you in meeting those needs. So we're committed to inclusiveness, committed to welcoming older adults into our service. So I would like to offer us as a partner. There are other groups for sure in this community that have risen up in response to the need for special care and service for older adults. We would like to offer the ability to connect you to those services as well. So we are skilled, we have expertise in serving older adults, and I'm going to tell you some ways you can connect with us now so that we can be of assistance. So right now we have a 50 Forward resource line. I'm going to tell you that number, but I know that this information will be shared in writing as well. But that number is 615-743-3416, or you can access us by email at info@50forward.org. So we quickly pivoted from our in-person services to really directing lots of folks to this resource line. The resource line is answered by our staff. So staff who are skilled, staff who are absolutely bound by confidentiality when individuals call. And what we are doing now ourselves at 50 Forward around essential services is connecting people to our case managers. So as you heard in the studies, there is a lot of concern about benefits access, insurance access, rights around housing, and the effects of decreased income on the ability to maintain housing, access to prescriptions, access to doctor's appointments. So our care managers are able to assist individuals, sometimes to the point of actually getting prescriptions and helping with that level of access for them. So a call to our resource line about those needs, very welcome. We can help with those different things. Access to food. So we saw in some of the studies concern about access to food and a decreased access to meals and food. So our 50 Forward Meals on Wheels, our FRESH program, already served about 70 individuals a day. We have exponentially increased access to food through that program. So calls by new individuals to our resource line are connected with our food program. And what we're doing now, again, it's staff doing this because we can control that very well, although we hope to incorporate volunteers back into the mix soon. So we are now delivering a combination of hot meals, frozen meals, and 2-week supply of groceries. We have partnerships with other nonprofits in the community to do that. So please give us a call. We can help immediately with those needs, and then also try to figure out systemically what are ways to make sure that access to food can be in place for individuals. The other needs, as we saw in the studies for sure, were these issues around social isolation. So our staff members have made thousands of calls over the course of the last month and a half, and we are providing support sort of at the level that individuals need. Anxiety has risen very much for some folks. Other people just like that check-in to know someone is there looking out for them. So 100% you'd be able to access our wellness calls, our check-ins by, again, our expert staff who are doing that. We also have a lot of virtual programming. So those of us who might be home now, isolated from other individuals, 50 Forward in a very new way has pivoted to virtual programming, mainly through our Facebook pages. So if you take a look at Facebook and 50 Forward centers, we have programming specifically geared to older adults. So meditation offerings, exercise offerings that are geared to different ability levels around exercise, other offerings related to wellness, and even fun things like cooking and bird watching and things like that, because we need to address the important things, but quality of life is about the spectrum for us as human individuals. So please take a look at what we have virtually. We're also going to offer some more things soon through YouTube. So we absolutely look forward to the day when we will be in person with our members that we love and welcome to our centers. We are committed to providing essential services now through that resource line. And we want you to please reach out and connect with us. You will let us know about needs we may not have anticipated yet. So we will learn from you about other ways that we can serve. So please reach out, let us know what your needs are. We want to serve you. We bring special expertise in working with older adults. So thank you so much. It's my pleasure to now introduce our next panelist, and that is Jasper Hendricks, who is the Director of Advocacy and Public Policy with Nashville Cares. Thanks.
Jasper, please unmute your mic and we'll be good.
Conference and one-on-one. So thank you. As I was
somebody just won a bingo game, right?
Yes. So thank you all for your time, for taking the time to participate in this webinar. And thank you to Councilmember VanReece and to the LGBT caucus of our Metro Council for their vision and insight in putting together this discussion. And thank you to our mayor, Mayor Cooper, for your support in this endeavor. Nashville Cares is Tennessee's largest 501c3 HIV/AIDS servicing organization. Our mission is to end HIV and AIDS epidemic in Middle Tennessee through education, advocacy, and support to those at risk for and living with HIV and/or AIDS. Since 1985, Nashville Cares has provided services without interruption to individuals at risk for or living with HIV and AIDS throughout Davidson County and 16 surrounding counties. And this has not changed. Since March 3rd, when we experienced a tornado that destroyed a lot of homes and businesses in our area and displaced a lot of residents. And then 2 weeks later, when our state went into a safer at home order due to the COVID-19 pandemic, Nashville Cares did not cease operations. Although our doors may have been closed to the general public, our wonderful team of staff and volunteers have remained on site and diligently working to provide services to the people living in 17 counties who are living with HIV and AIDS. And then also providing ways for persons who are seeking HIV testing and other preventive measures, ways for them to receive these items at home. And I'll provide more information to you about those programs later. Since the beginning of the COVID-19 pandemic, Nashville Cares has provided over $250,000 in rental, mortgage, utility assistance to people living with HIV and AIDS throughout the 17 counties. It's more than 5 times the amount in which we received that we gave out last year during the same period of time. So yes, People who are living with HIV, a majority of them are people who are LGBTQ in community, members of the LGBTQ community, have experienced a lot of financial hardship during this time. But Nashville Cares has been there. We have also continued to provide fresh food to over 1,000 people living with HIV and AIDS weekly, and address transportation needs by distributing over 200 bus passes and providing over 75 rides through partners such as Uber Health, so that people living with HIV and AIDS can continue to their vital medical appointments and essential needs each month since this pandemic has started. Thus far, the staff of Nashville Cares has provided over 3,500 hours of client contact, 500 hours of behavioral health support, and over 150 hours of white eligibility support, and more than 300 hours of early intervention services and support contact, and over, most importantly, 270 hours of psychosocial support. Because our clients and our people within our population are feeling the impacts and are experiencing a lot of emotions and isolation, feeling of isolation during this time. As I mentioned before, HIV home testing is available. If you call a number, and that is 615-761-4474, we will FedEx you free of charge a home test that you can take, and our team, led by Lisa, will set up a Zoom even to help you at home and walk you through the process if you are unsure once you receive the information, once you receive the test kit at home on how to use it. We will walk you through that process. We also have expanded our telehealth counseling, and you can receive more information about our other services by contacting our hotline at 1-800-845-4266. And this information will be made available to you guys, and we will keep you up to date as to when we will be open in full operation. But we are working with health professionals in our mayor's office and making sure that we have the most safe possible environment for our clients and our volunteers. If you visit our website, we also have information on resources for people living with HIV and COVID. And also there's some special guidance listed there as well. And that can be made available to you as well. If you email me, I will get that back to you. Again, thank you for the opportunity. I really appreciate this time with you guys, and I look forward to the questions.
Thank you, Jasper. When the caucus met and had the idea of doing this webinar, we focused on three groups of our most vulnerable populations, those that have HIV or AIDS or other immunodeficiencies, elder folks in our community, but then also our heart is wholeheartedly on youth experiencing homelessness in Nashville, particularly LGBTQ youth. And we have with us today our third resource group, Rosemary Pink, the board president for Nashville Launchpad. And so we send it over to Rosemary.
Thanks. So Nashville Launchpad, we're an organization that does emergency shelter during the coldest season in Nashville. We've been doing that for 6 years now. Our focus is on youth 18 to 24. We focus on being LGBTQ, open and affirming. The facts around homelessness are bleak. Ultimately, anyone can experience unstable housing or homelessness due to things outside their control. As we've seen with the tornado in March, sometimes being prepared doesn't help. LGBTQI folks make up a disproportionate amount of people experiencing homelessness compared to our overall share of the population. Based on what we've just seen in the previous presentations, if that's around 6 to 8% of Nashville, people who are LGBTQI identifying, we see people in the range of 30 to 40% of the population that we're seeing are LGBTQI. This is likely affected by family rejection, both housing and employment discrimination at times, trans folks often being hit the hardest in those categories. So while we normally do shelter between November 1st and the end of March, this season in mid-March, obviously things were really changing. We often operate with a lot of volunteers. Our volunteers range entirely across the spectrum of ages, but some of our return volunteers are people who are older, and we felt that it was getting unsafe for them to be volunteering, and the congregate shelter model seemed really unsafe. We moved to doing shelter in an extended stay motel with more minimal staffing. It allowed us to maintain shelter of youth while still keeping on our seasonal employees, and it gave youth the option to isolate and stay safe from the virus. This was a very big and expensive undertaking. We also kept going past where we'd normally end. The shelter-in-place order went past the end of our usual season, and we felt that we need to continue as youth would have very few options while the city was closed. A lot of the resources that homeless people experiencing homelessness depend on, like the library, weren't available because, again, places where people congregate. I think, we've been able to keep it going. We formed a partnership with Oasis for support while they've been out of their building. They've been very, very helpful through that, and have helped connect all of the youth with case managers. And so we're actually going to have really great results this season in terms of the people who we've been seeing. We're going to be able to see around half of them moving into something that is a longer term shelter option or housing. But we have to move away from congregate shelters as the model for the work that we do around sheltering people experiencing homelessness. We know that shared bathrooms are a huge source of contagion. So you can socially distance people, but if you have hundreds of people using only a few bathrooms, that is still a situation that is ripe for spreading this virus. We know that a lot of people transmitting this are asymptomatic. Everybody is very keen on temperature testing, which is great, but that's not going to catch people who are asymptomatic and infected. And that's a time period where they're obviously very able to spread the virus. As we know from the results from the mission, most of the people who tested positive there were asymptomatic. Very few were sick. We have to be proactive about this. If we don't move away from congregate shelter, we're going to be allowing people to die. We need support to keep housing people this way. We need to be moving towards new models. It's a huge undertaking to try and start thinking about new ways of doing this, but that's where we are right now, and we've really got to start that process.
Thank you very much. We have about 10 minutes left in our time period, so we're going to move to the Q&A portion. I appreciate folks sending in their questions to my email, nancy.vanreece@nashville.gov. It is important for you to know that you can continue asking those questions. They will be forwarded to the right folks to get answers. I did have a question that came in from Jace Wilder at Belmont University, asking about the factors that Vanderbilt study may be causing the most damage to healthcare for LGBTQ community during this time, and what some key interests that you believe are worth deep diving further into future studies based on the data that you have. If someone would like to take that question.
Sure. So several of the concerns that we have are around people being able to access routine care if they have underlying health conditions that they're already managing, chronic conditions, heart disease, hypertension, asthma, diabetes. We want to make sure that they're actually getting the care that they need in this time when healthcare is already scarce and complicated and stressful, so that they don't have additional complications related to their disease that could have been prevented. Those are things that we're certainly concerned about. We're concerned about folks accessing medications. People with the community partners have identified various ways to make sure that people aren't losing access to their medications. We're still seeing a lot of that, so we need to connect people to make sure that is something that can be happening. And we have a lot of folks who are actually working in the healthcare sector in some of our surveys who are stressed out, who are worried about exposures. We need better information to help them kind of manage some of those interactions and stresses as people go forward. Dr. Gonzalez, would you like to add something in addition?
Thank you very much. I had another question for you guys, just kind of wrapping up the factors that contribute for the higher risk to LGBTQ. But then also someone wrote in, evidently saw our Twitter exchange about gay men and lesbians actually wearing masks and staying home a little bit higher than average. If you could point on those things.
Absolutely. So we're just starting to look at some of the other things that we can get out of these data. There's some information circulating now that men in general are wearing masks less often than women. So the kinds of precautions that are being undertaken and certainly the impacts are gendered. We've seen that in terms of how the epidemic is affecting women's work hours, for example, especially people and couples with younger children at home. Women are kind of taking on more of the burden of childcare and house care, despite also working or having to reduce their working hours in different sex couples, especially different sex couples with kids. So some of the things that we can continue to look at are maybe how gender and sexual orientation are continuing to shape how people respond. So one of the things that we see just in the data that I didn't mention that was in response to someone saying essentially not all men, gay men are wearing masks and taking precautions. And that's kind of what we're seeing, right? So we see elevated rates of mask use among segments of the LGBT population. So gay men are wearing masks more, especially after this May 1st date when we kind of are all getting a little more used to this idea. And we see definitely some elements across gender within the LGBT community where we see evidence that lesbians are staying home more than their gay male counterparts. We see evidence that lesbians are wearing masks more than their gay male counterparts. And the differences here are a few percentage points. But if we're thinking about reducing risk, we want those to be as high as possible. And so we can continue to kind of think about how gender and maybe now sexual orientation are structuring how people respond, what they see as the risks and so forth. I think that's something that we could kind of continue to talk about and have conversations within our communities about.
Thank you very much. We did have just one point of clarity for 50 forward. The timeline, and if you could repeat that number for services, I know that you're not a 24/7 line like some are. Could you explain kind of the times that that support is available for us, Gretchen?
Sure. Our resource line, the number again is 615-743-3416, or you can email us at info@50forward, all spelled out, .org. And the phone line is answered from 8 until 4:30, Monday through Friday. So our meal deliveries happen during the weekdays. If you call us on a Friday afternoon, you might get a call back on Monday. That might be what that would look like. That's just how our services are structured. Thanks.
Thank you for that clarification. You guys have been absolutely amazing. On behalf of the LGBTQ caucus of the Metro Council, we thank you for responding to our request to talk about this. Just a few wrap-up resources that I want to make sure everyone has. The local Nashville LGBTQ Chamber of Commerce is doing similar and very important work in regard to how our community is affected in the course of business They are a member of the Small Business Task Force, and the chamber is ready and willing to be helpful to you. Also, as it was mentioned, Nashville Pride has a series of task force put together. There is one very active on healthcare as well as older adults. And we're seeing more and more of that information kind of cross-reference. So reach out to Nashville Pride, reach out to the LGBT chamber as needed. There are a couple of other national resources that we wanted to make sure that you are aware of. One of the common denominators between Vanderbilt, 50 Forward, and myself is the Join All of Us, the All of Us research program. The NIH project with Vanderbilt and 50 Forward as key partners is something that we're very proud of. If you haven't looked at the opportunity to take those surveys and participate, you can go to joinallofus.org. You can /LGBT to find information directly on our community. Also of key interest to me is the work happening at the Pride Study. Pridestudy.org is a study of Stanford University School of Medicine in partnership with the University of California in San Francisco. I am a national ambassador to that, and we have been combining our efforts with All of Us research. A study recently launched by the Pride Study. There are now 18,000 LGBT participants in the Pride Study. Has a new study that has been launched to fill out for additional survey, if you will, to talk about the impact of COVID-19 on LGBTQ plus communities, including physical, mental, and social health impacts. We are particularly excited about the collaboration of Vanderbilt, of 50 Forward, of the Pride Study, of the Mayor's Office, of this council, and all of our community partners for doing all we can to reach out to everyone that we can. I really appreciate everyone. Again, I want to thank Dr. Tara McKay and Dr. Gilbert Gonzalez from Vanderbilt, and then also our special community guest, Gretchen Funk from 50 Forward, Jasper Hendricks from Nashville Cares, and Rosemarie Pink from the folks at Nashville Launchpad. On behalf of the Mayor's Office and the LGBTQ Caucus of the Metro Council, we thank you again. This recording will be up on the Metro Nashville Network YouTube channel, and the slides and everything presented, as well as other additional resources, will be available on the COVID-19 Nashville resource page. With that, thank you very much. I appreciate everyone's attention, and we look forward to working together with you on all the things that we have in front of us. Thanks again, everybody. So long.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.